News and information from Georgia State experts about the current global health crisis. This is 88 Affairs, a program for our Georgia State University community and WRAS listeners. I'm your host, Andreas Preuss. Joining me for a conversation about public health during this pandemic is Monica Swahn. She's an epidemiologist and a professor at the Georgia State School of Public Health. Swahn is the former Associate Vice President for Research and was previously the Associate Dean for Research for the College of Health and Human Sciences. Monica Swahn, thanks for joining me.
Well, thank you. It's great to be here with you.
My first question involves the conflicting sentiment. I wanted to say policy, but it may or may not be, and it varies, is the whole issue about mask wearing. You're an epidemiologist. What are you recommending people do?
Of course, I recommend everybody to wear a mask. I mean, it's such an easy thing to do. It is a great way to prevent the community spread of COVID. But I agree with you, it's really difficult to understand why we have seen so much backlash against using a mask. It's something that we really need to do a better job in trying to figure out what we can do to really encourage more people to wear masks.
As a professional in this field, this is an obvious thing. I mean, this isn't just with the COVID, it's with any virus and also involving public health that the best way to control certain afflictions is by wearing a mask.
That is true. I just think that in our recent history, we've just really not come across the need to be wearing masks. So there's something about the social norms perhaps in our culture that people think of them as foreign. They're not used to wearing them. And it just seems perhaps a little bit odd. So I think perhaps for those of us in the U.S., we have approached this a little differently. But the research is so compelling. The data is so compelling. We are at a point now with so much community spread that wearing a mask is critically important for protecting our fellow citizens. It's really key.
Well, it may be really key, and you have a lot of data to support the mask wearing, but there are people out there that just don't want to wear a mask, whether it's for personal reasons. I can't wear a mask because I can't breathe. And also mask wearing has become very political. It's almost like a political statement to where you wear or don't wear a mask, you're making a certain decision based upon politics potentially. And is that something you've ever seen in the history of public health, that a device that prevents people from getting ill is now actually controversial itself?
It's very unfortunate that this very basic, low-cost, easy implemented strategy is considered political. And I'm not really sure how we ended up there, but here we are. And so we got to figure that out. But in terms of other intervention strategies, I mean, I remember when seatbelts were introduced, I mean, there's always a little bit of a backlash when we talk about changing people's behavior. Behavior change is always difficult when it comes to, I think, in particular, public health strategies, because sometimes people don't appreciate how their individual actions contribute to the larger whole. And that's where we are with the masks, that it takes all of us wearing masks for the whole concept to work.
In the early stages of the pandemic, there was a lot of confusion about mask wearing. You had the Surgeon General come out and say, you don't really need to wear a mask. It's not really going to protect you. And there was a lot of back and forth about the mask. And now you got to wear a mask. At least that's the message that's coming from people like yourself that are in the public health sector. So is that something you want to get a handle on very quickly involving a pandemic? You want to get the message out right away about certain social things, whether it's mask wearing, social distancing, washing your hands. It seems like the message was very confusing in the beginning.
When I go back and I look at the reporting from a couple months ago, February and March in particular. And so it has been confusing for people because we were clearly told by all the leading experts at the time that masks were not important. It was really not highlighted as a key priority. But if we go back and look at the data from that time, we did not have the substantive community spread that we do now. The scenario totally changed. And, I'm a big fan of Dr. Fauci. Really appreciate his work over so many decades. And when he came out as one of the leading experts and said masks are not relevant right now, he prefaces that by saying, for now, but things can change. Mm-hmm. And I think what happens here is that people forget that things have changed dramatically. So the people who didn't want to wear masks hold on to that message, even though all the circumstances have changed, where the statements that wasn't clear back then, but now it's changed and we really need to be wearing masks. But again, whenever there are miscommunication or whether they're confusing guidelines, guidelines, people don't really know what to do.
In Georgia, Governor Brian Kemp was one of the first in the union to reopen the state for economic reasons, to get the economy back on its feet and to get people working again. Also, the whole issue with the mask wearing that here in Atlanta, the mayor, Keisha Lance Bottoms, said we're mandating mask rules. But then the governor comes out and says state law overrides local law. So there, once again, you've got a city mayor, a big city mayor saying wear a mask, and the governor saying he is saying he's recommending to wear a mask. He's not saying don't wear a mask. He's been touring the state saying you should wear a mask, but he's not mandating wearing the mask. Is this another signal that once again people are getting confused?
For those of us in public health, I think we see this kind of mixed messaging to be very harmful for us making progress and for reaching the public with the messages that they really need to hear. I mean, I'm glad that Governor Kemp is recommending people wearing masks, but of course, as a public health person, I think people really need to be very, very strongly encouraged to wear masks as soon as they leave their homes and they're in public settings. And so I don't really know what we can do. I mean, we cannot be telling our governors and mayors, what exactly to do. But I'm really wishing that the communication would be much more clear and consistent. In particular, as we have, a surge of new cases in Georgia, in Atlanta, we really need to be so much more vigilant and take care of one another. And the best way to do that is to keep our distance, wash our hands, and to wear the mask.
And we will be speaking about the surge in positive test results and the surge in testing. But one more comment on the mask wearing. If you mandate something, that means you would be enforcing it. And I don't quite think that's been figured out yet. That's all fine and good to mandate something, but then how do you enforce it? It just seems like that hasn't been figured out yet, whether it's ticketing people or expelling them. I mean, Walmart and other big chains said that, they're mandating masks when you go shopping in their stores. What are they going to do when the person says, I don't want to wear the mask, and to turn them away? But the enforcement issue, is that something that really public health officials don't get involved in? That's more of a legal criminal justice issue or a city-state issue?
My opinion on the matter is that I think that the stores, for example, that are mandating, requiring masks, before entering their establishment is really a sign, right? It's a signal that we are taking this incredibly serious, not only for all our customers, but also for our staff or the people that are working in these places. And so to me, it is not as much about enforcement as it is getting the business and the public health and all these different stakeholders and communities to really be pushing the mask and signaling the severity that we mean business. We have to do it this way for the stores to stay open. If we're not getting control of these surges, we're going to be closing again. So everybody has to have some kind of responsibility in that. And that's where I think that the public health message is key. The enforcement important, but secondary to encouraging the public to do the right thing.
Seatbelts are now enforced. If you're pulled over and not wearing a seatbelt, you would get a ticket, and that's pretty much acceptable.
The interesting point here with the masks is that we're not typically wearing the mask to protect ourselves. We are protecting others from it, right? That's the primary goal. And so I don't know. I mean, I've not seen any research on this yet, whether that really makes a difference in terms of adopting this new behavior. But it is very interesting. And I think what happened here is that being requested or required or mandated or encouraged to wear a mask happened relatively quickly, right? I mean, this pandemic has, right in the U.S. and really took foothold so fast that for these behavior changes, that takes much longer time. It even take years for people to normalize and get adjusted and adopt the behavior. We've not had that kind of time, and we absolutely do not at this point.
I'm speaking with Monica Swahn. She's an epidemiologist and a professor at the Georgia State School of Public Health. As you've been mentioning, this is a very interesting virus, and it's still very mysterious. There's still lots of data and research and things like that that have to be conducted. And of course, right now we're getting a lot of testing. And then, of course, you've got the surge now with more COVID-19 positive results.
Really troubling numbers. I tell my friends and colleagues who want to hear my COVID advice is that when you're out and about, just assume everybody has it. Assume everybody has the virus and take the appropriate precautions, because that is the community spread levels. They are so high that, of course, the official testing, and as you mentioned, the testing has gone up dramatically. And so we are capturing more of the cases. But given this level of community spread, we also know that there's so many cases that we're not testing and we're not counting. That is a huge issue that is really alarming for those of us in public health trying to predict what's going to happen next in terms of morbidity, illness, death, or the ICU capacity, all those pieces. And you mentioned too, I mean, we don't know all there is to know about this virus. I mean, I think sometimes we forget it's really only been around for a couple months for practical purposes. And doing good research, analyzing data, and making conclusions takes time. Much of what we knew initially was based on the outbreak in China. And of course, their system and their way of interacting and healthcare, all of those things look very, very different than they are here in the U.S. I mean, just think about how fewer kids there are per capita in China than we have here in the U.S., the risk to our children and school starting. So we are lagging behind in terms of the data and the conclusions and what the next steps can be from that. And so we have to stay put. Safety has to come first.
What about the surge in the younger population? I think in the early stages, once again, it was the elderly. African Americans were hit pretty hard. Now you have a lot of younger adults testing positive. Is that just because they're more inclined to leave the confines of a quarantine or wanting to socially connect with their peers? Why are we seeing these rise in these younger positive test results?
The miscommunication or the misrepresentation early on where, facts were presented that, COVID and serious illness, morbidity and death primarily impacted the elderly. I think that message really resonates, right? And so a lot of the young people still haven't gotten to the point that they can also be vulnerable. So I think that kind of miscommunication, or we've kind of changed our view on who can be impacted, who might be at risk. So that is changing. I also think in terms of what you're mentioning, the social distancing, perhaps. I think people mention this kind of quarantine fatigue that, after months of being isolated and summer and spring, that perhaps it was the younger people who took advantage of that, went to the beaches and went to all these gatherings and went to the open bars and things like that. And now we're seeing the impact of that.
And we're conducting this interview on July 16th, and the latest numbers from the Department of Public Health is 127,000 confirmed cases, a little over 3,000 deaths. Just today alone, they've had 37 deaths and 3,800 confirmed cases. So the numbers are going up again. And there's this whole story or narrative of people, from what I understand, young people that want to get the disease. They want to just get it over with. Does that make sense? Is that something that's bizarre in the world of public health?
It is really tragic. I read in the news where there were these COVID parties and people thought it was a hoax. Some people thought that they were just going to get it and be done with it. It is a frightening scenario. The research is still lacking in terms of what the long-term consequences are. I mean, if you watch the news, we hear personal accounts from journalists and others who have gone through the virus themselves and had quite a hardship. And they talk about having symptoms months after having technically been cleared from the virus. So that to me is really, really alarming. And again, don't want to sound like everything is sad and negative, but we really just don't know about that, which is why we are urging everybody to take the necessary precautions. Because again, if this is a virus and the consequences may last for years or a lifetime, we just don't know that yet. I mean, that is a terrible position to put a young person in, to live with those potential disabilities.
What is the thinking about the antibodies? If you catch COVID and you were confirmed positive and you had symptoms, and let's say you recovered because you were lucky or did the right things or even hospitalized, are you then immune for the rest of your life?
So as far as I can tell, the jury isn't quite out on this, and the experts have not agreed on it. And again, I think, I hate to say this point again and again, it's just that we don't have enough data. But I've certainly read all the news reports and the data over the last couple days and weeks where there are new studies indicating that antibodies, meaning the way your body would protect itself in case of a future transmission, that they do not stay in your body that long. What that means, if true, is that you're very likely to be able to get the virus again, unless the body somehow has some kind of memory function in terms of protecting itself. So if that is true, and let's hope it's not, but if it's true that the antibodies and your body does not remember how to protect itself from the virus, it means that you can be susceptible for the virus again. And that also means that the way we've talked about a herd immunity, which is a little bit difficult concept, but usually we talk about herd immunity when maybe 60 or 70% of the population has gone through a particular disease or virus. It just really means that the virus would have really no place to latch on and be very hard for it to spread. But if the antibodies do not last, that this this concept of herd immunity is a moot point. It doesn't hold. It does not apply then in this case. And then we would also question the utility of vaccination. So I hate to even bring that up because, like I said, the research hasn't borne fruit on this yet, but there are some preliminary findings that give us pause really in terms of what the next steps may be. And again, if herd immunity will not be something that we can realize in the U.S., if vaccination is not, then we have to be talking masks and social distancing because we'll have no other tools. So this is to be determined. I mean, this is stuff that's going to be evolving over the next couple of weeks and months. And fingers crossed that these preliminary reports are, they have some other issues and that, we're going to see antibodies and the fact that people will get it once pretty much and that will be it.
The surge happened early, and then in the summer, you're having a surge now before the predicted surge in the winter, or is that just because summer and people are getting out and they're just tired of being quarantined?
I mean, I have colleagues here in the School of Public Health who do modeling and forecasting what this looks like. And so many of the models, they take different factors into consideration. And they've also, you might have seen these in the news too, how they've looked at cell phone data, for example, to see how people are moving and if they're distancing and using technology in really cool ways. But the sad thing is that there were some predictive models suggesting that if people weren't socially distancing, wearing masks, in particular in the states that opened very early, even though we've not seen a clear downward trend in cases before they opened, this was a risk. I mean, this was a risk that we spoke about in many public health communities and forums about what's going to happen next. And I think in some ways, this is the worst case scenario. In the states that open early and where people thought that it's like, okay, we've conquered this, now we're out and about, we see this virus come back with a vengeance, if you will. And largely, I think some of these states were unprepared. We weren't ready for this surge. And, in terms of personal protective equipment and all these other restrictions, which is why we see some of the states going back to closing things down. And the other piece that I think is really important is that people kind of assumed that when the weather was going to be hot and warm, the virus would kind of step aside for some reason, but it didn't, right? But again, it's hard to know exactly what is the properties of the characteristics of the virus versus, human behavior, because it's the human behavior that humans are kind of the vessel for the virus, right? We transmit the virus to one another. So it's a really tricky situation.
I'm speaking with Monica Swahn. She's an epidemiologist and a professor at the Georgia State School of Public Health. Professor Swahn, and I know you're not speaking on behalf of Georgia State or the School of Public Health, but it seems like one of the lingering stories or storylines in this pandemic is public health versus politics or economy, where you've got public health officials saying it's too early to reopen, and then you've got government officials saying we need to get our economy going again, going strong, getting people back to work. Is this a narrative that you've seen before in public health, that you have this dichotomy between two very large sectors that are kind of battling each other?
It's a really tragic situation overall because there are so many difficult decisions to be made. I think whenever a public health issue has important policy consequences, one got to weigh the pros and the cons or the benefits and the adverse consequences of any kind of decision making and policies that impact these many people. But I cannot think of any other public health issue in recent times that have been really caught in the middle here. Many other European countries have handled this very differently. And I really wish that we could look at some of those examples where they have balanced schools and work and opening their countries in a very different way, but still balancing the spread. Now, the case of Sweden, for example, and that's where I'm from, is very different. But the reason why they could contain much of their spread is that they apparently some half of the adults live in single households. That's a very different kind of demographic profile and structure than what we have here. So any kind of models that we borrow from elsewhere needs to be factored in and adjusted, obviously, for the U.S. population and what we look like, or what our situation is like. But regardless, the only thing I can say is that it's really sad when a public health issue becomes this politicized, and it's not really even clear why it needs to be so political. Clearly, people are really hurting. People need help. We need to have the capacity to treat people who are sick. And when we're not managing the outbreak the way it's going through our communities right now, people will get hurt. Lots of them.
What is a bigger tragedy, whether obviously if you die, it's a huge tragedy, or you're unemployed and you don't have any money and everything's closed and you can't make your payment on your apartment or your lease. That's a certain type of death as well. It's a tough spot for people to be in because people do want to be successful and healthy and all that. So it may not be that you can't have everything at the same time and something's got to give. And what is that? And what decisions are you going to make about your own personal future? At the end of the day, people are going to make their own decisions about wearing masks, about socially distancing, about what stores or restaurants they visit. The restaurants are open, but I don't see that they're packed. I think people are kind of used to ordering out. Cooking in is a great thing that people are doing now, reconnecting with families. But like I said, it's the economic issue for sure that you can't, if you can't afford your rent, then that's a big problem. That's a lot of stress unto itself. And then the added stress of, we could all die. That's crazy times.
It's crazy times. I work in violence prevention, do a lot of alcohol research. And so in many of these scenarios, when people have been in quarantine and social distancing at home, we've seen increases in alcohol use. We've seen increases in intimate partner violence and child maltreatment. So there are a lot of metrics that indicate that there's been harm done in so many different ways. We may not have anticipated or did not have strategies to really remedy, in addition to the financial ones that you outlined, which are really terrible. So I really hope that as a public health community and in terms of government support, we can really provide more resources for the people who are suffering the most to make sure we uplift everybody, because we need everybody to be successful and healthy as we come out on the other side.
The point you make about alcohol abuse, drug abuse, child abuse, these were big issues. They still are big issues because you didn't have children going to school where a third party could see them and then report to child welfare services that something is going on. And if you combine that with stress, and look, liquor stores never did close. They were deemed essential businesses. And that could be a lethal combination there. And the data isn't in yet, but that's going to be fascinating to look at.
I know. I have several colleagues. We are, I shouldn't say we're eager to look at that because that sounds really insensitive, but we really hope to make sense of the data and try to make recommendations for future scenarios. And of course, as you mentioned, financial stress is a very, very important risk factors for stress in the home.
What do you think fall 2020 will look like? There's a lot of debate currently about online education versus in-person, mandated mask wearing, socially distanced classrooms, staggered entries into school. This must be one heck of a thing to figure out where you're putting tens of thousands of children in a school. Yes, there's the educational aspect of it, but also the social aspect of being in person. That's got to be a tough spot to be in for educators.
It's incredibly difficult. The educators and the decision makers in these environments are tackling incredibly difficult scenarios and have to compare and contrast what's going to happen in case there are COVID cases in the classroom. Does the whole classroom need to go get tested? What happens to the teacher if the teacher teaches multiple classes? I mean, you can just, like these thought experiments, right? I mean, they get incredibly complex really quickly. And again, I mean, we don't have an infinite supply of teachers. I mean, we have to make sure that the ones we have stay healthy to take good care of our kids. So for now, I think that some of the school systems are still pending what their strategies look like. We know with the surging cases, at least what we have here in Georgia, that our fall of 2020 will not look anything near normal. It could have been normal had we perhaps handled things a little differently and we'd not seen this second surge. Maybe there would have been some sense of not quite normal, but more normal. So we're just going to have to take this week by week and month by month and see what is the best for our kids and for the educators and for everybody, really. I mean, these are public health issues, means that we cannot just think of individual families and individual persons. We have to think about these issues as a community, and that's what we do in public health.
Once again, you're seeing another thing become political, and that's education. So once again, you've got go to school, in class, in person. Don't go to school, online. So once again, just like the mask wearing, it seems to be developing into a political discussion.
Yeah. And like I said before, I think it's very unfortunate because we really need to put our best brains on this and do these thought experiments and really see where they lead. I'm a mother of 3 children. They're not as young anymore. I can certainly relate to the difficulty of if I were to have to work at home with the kids present. I also know what it's like when the kids are not in their routine. I can see all sides of this. And I'm really just hoping that before this gets any worse, that, like I said, we can bring everybody together to kind of make the best plans that we can. And not that we're in full support of that. And that, like I said, we help those that need an extra buffer. For example, if we know that there are other vulnerabilities, that we try to put in some strategies to buffer those, to ameliorate some of those potential hardships that people are facing. It is unusual times. I mean, not in my lifetime, and perhaps never again will we see something this dramatic shift our day-to-day life. And it's not over. We really have to hang in there until we can get to the other side of this.
Because the nature of a pandemic is millions of people are involved, we all have a personal connection to COVID-19 because we're all living through it. Your father passed away in Sweden from the disease. Can you tell us a little bit about him?
Sure. My dad, actually, he lived in Thailand. He had retired there and lived the life he had already dreamed of. But being that both he and I are from Sweden, he visited Sweden on occasion to connect with family and friends. And so it was during one of these trips to Sweden earlier this year that I saw him in January, and we had a great visit. But after I left and came back to the U.S., he started talking about having a cough. And we didn't think that much of it because it was winter and cold in Sweden. So having some cold and cough wasn't that big of a deal. But he started acting really odd. And so when I was trying to reach him, he just didn't seem coherent the way he usually did. And so very sad. I mean, we managed to get him help at some point, get him in an ambulance and to go and get treatment. It turns out he needed to be put on a ventilator right away. And he was on a ventilator for several weeks. You know, it went up and down, but at the end, he just didn't make it. I wish we would have gotten him help sooner, but he was incredibly stubborn, and he was also incredibly healthy and fit. He didn't think of himself as needing care, and he just thought about this cough. But as we started learning about geriatric populations, which we didn't really know much about at that time, if we go back to early mid-March, some of the symptoms that he had didn't fit the typical profile of COVID the way we had shared with it then. So it wasn't even the first concern that I had when I talked to him, and he wasn't doing well. But as he, like I said, he deteriorated, I realized he really needed help, and he declined an ambulance. It wasn't until a couple of days later he really went with them. I wrote a blog about this as a way to give a tribute to my dad. And there was a little bit of a funny story in this, if one can call it funny. But because he was so fit, he actually did some regular squats in the parking lot, trying to convince the ambulance that he was too fit to go with them, which is kind of funny, right? So he had breathing issues. He did not get enough oxygen, right, breathing, and he still managed to do some squats in the parking lot. But luckily, they took him with him and put him on a ventilator. Turns out it didn't change the path for him. But again, it just speaks to that he can stand there in a parking lot with a fever and all those things and still manage to produce some good squats. So it taught me a lot, and I share this with I teach global health students every semester, and I didn't share this about my dad necessarily, but we talked about the outbreak and how it was spreading in the world, and the fact that we don't always know what the symptoms look like. The sad thing here, with so many deaths here in the U.S., most of us will know somebody who has died. And that personal connection, I think, is really important as we think about how to move forward. And also think we need to find a way to honor those who not only have, that have died or passed away, but also the people who are serving, our nurses, our healthcare professionals, the people who are putting their own lives at risk if you take care of all of us that need their help.
What was your father's name?
Oh, Markku Haavisto. So he was from Finland originally, but Markku Haavisto, that's how you would say his name in Finnish.
God bless you and your family. That's a tough thing to go through. And living through this pandemic is very interesting. I think there will be a post-pandemic generation, which is changing people's lives. But like I always say, humans are resilient. We will get through this.
Oh, we will. We will get through it. This is an unprecedented time, and this will certainly mark our children in a way that we have not seen for generations. And we will be studying this for a long time forward to understand exactly what the health consequences were, what the implications for the social distancing, for all these layers that we just really don't understand yet. We just don't.
Monica Swahn, thanks for joining me.
Well, thank you, Andres. This has been a great conversation. I really appreciate you having me.
This is 88 Affairs.
news and information for the Georgia State community and WRAS listeners. Views expressed in this program are not representative of Georgia State or the GSU radio station. For more on-program content, please follow at WRAS 88 Affairs on Twitter. I'm your host, Andreas Preuss. Thanks for listening.